Imagine that you're crossing the street in New York City and you feel pain in your chest. Some good Samaritans come up to you, dial 911, and stay with you while you wait for the ambulance. But there's huge amounts of traffic, and it took 30 minutes to get to you. Then once you got to New York Presbyterian, you waited another 3 hours to get discharged. It turned out it was nothing serious, but the next time you don't want to waste 4 hours of your day just for nothing. And what if it was a life-threatening issue? There must have been some proactive way to receive medical care rather than just waiting. Stories like this are not uncommon. Wait times for emergency rooms can take hours. Some people they actually need emergency services, but others simply want to see a doctor. The result is long lines and hours wasted by both the patients and medical staff. This is the problem we are solving with the myERbuddy app. The app will search and direct you to the nearest ER or urgent care facility based upon your condition, distance, and average wait times of the hospitals. It will dial 911 or call a taxi for you. It will also let you e-register in advance and forward that information to the care facility before you get there. The myERbuddy app is a web-based solution to a pressing healthcare issue. So now, let's see the demo. You start on the home page and you enter in your current medical condition. In this case, we are experiencing chest pain. The app will automatically geolocate your phone. Otherwise, you can enter in your current address and zip code. In this case, we are simulating that we are at Grand Central Station in New York City. You can enter in your insurance provider or hit NA if you have no plan. Hit Submit. Now we'll take you to the map page. Once on the map page, we will take your location as well as condition into account and will find the nearest ER or urgent care clinic within 2 miles of your address based upon the location's specialty. You can select which facility you wish to go to. The app then uses Google Maps to calculate the best route for you and provide estimated wait times at each of the facilities. You can then choose to dial 911 if you need an ambulance or dial a cab service from the app. After you select a certain facility, you can hit pre-register, which takes you to the registration page. At the registration page, you can input your information, which may be pre-filled beforehand. The app will send that information through our HIPAA-compliant servers to the specified facility before you get there to save time. You can also go to the contacts page to find a list of pre-filled emergency contact numbers. The app will enable you to send a text message or call them. Once you get to the ER, you will be notified of approximate wait time and given periodic updates by the app. You can also request post-discharge instructions, follow-up care, and pay your bill through myERbuddy. So in this video, we saw how technology and connected devices can provide better information, engagement, and connectivity to our citizens, especially seniors and immigrants. We used Ionic for the hybrid mobile app with a Node.js server on IBM Bluemix, Google Maps, and Arrow Taxi API to connect citizens to various emergency care options throughout the city. The same technology and user-generated analytics can be used to create many service-oriented city solutions. Why is this app important? To be a connected city, we have to bridge the digital divide by deploying technology smartly to benefit all citizens. We can make a significant impact without huge capital investments in our large diverse city of different ethnicities, education, and income levels. We seek to create efficient and effective linkages between individual patients and EMS who use the app, as well as the hospitals, city agencies, and insurance companies who administer the healthcare system. New York State spends about 17% of its GDP on healthcare and is expected to spend close to $300 billion by 2020. Readmission due to errors and inadequate follow-ups is costing us almost $5 billion per year, and we have the 4th longest ER wait time by state of 6.1 hours due to overcrowding, facility closures, and shortage of inpatient beds. So we're spending all this money and not getting the best results. Also, this rising healthcare spending is leaving us with less funds for other important public services like housing and transportation. That's where myERbuddy comes into the picture. It's a low-cost smartphone app for connecting citizens for better care, better engagement, and better cost efficiency.